everyone. Thanks for tuning into this episode of the Compression Thinking series. My name is Ethan Berry, and I'm joined by Robert Doc Hall, co-founder of the Compression Institute and professor emeritus at the Indiana University Kelley School of Business. Doc's career started in engineering and manufacturing. His experience in these fields is what paved the way for his realization that current business models are contributing to the destruction of our planet. How do we get along without leaving too much of a mess? How do we adapt to a changing environment? Well, these are some of the questions Doc has been asking his entire career. This series is about how you can help to make a difference by making nature a stakeholder in your business or community. To do this, we need to change our values. But before we can do that, we need to change the way we think. If you enjoy this series, please don't forget to like, share, comment, and subscribe. Doing so helps us spread this program to more people and more communities who may benefit from the message. Now, you may be wondering what we mean when we use the word compression. Well, in the context of this podcast, compression is a reference to the squeeze we are putting on nature. To ease the compression of nature, we need to compress the way we live. Compression thinking is a guide to help us do just this, hopefully before it's too late. So how do you become a compression thinker? Well, you'll just have to keep listening to find out. Today's topic is healthcare. Now, most of the conversations regarding healthcare center around how we're supposed to pay for it. We decided to approach it from a different angle today. Specifically, why are we paying so much for it in the first place? Doc, so before we begin, let's get some terminology out of the way that our listeners may not be familiar with. Could you please explain the difference between curative and preventative healthcare?
Curative care, figure out something is wrong with you, and then you try to restore you to the prior condition, whatever it was. And so that frames an awful lot of what we call curative care today. It's find and fix. And there's a lot of concentration on it. It costs some money. Preventive means not really getting sick. That is, you remain in good enough health to do most of what you want to do, and probably without having to pay much conscious attention to health because you just have habits of living that do it for you.
So you're just living your life in a way, you're adopting healthy habits, like you said, that prevent you from getting as sick as people normally do today.
Yeah, maybe we ought to talk about the sorry status of health in the United States. Infant mortality is, 5.8 or whatever. We rank about 55th down in all countries of the world in infant mortality, and health people like that measurement because it infers a lot about the status of public health in the country. Public health meaning, sewage systems and water and the things that ordinarily impede health. Second measurement is our longevity. 78.6 years at last reading. We're, like 30th, 32nd, something like that, down on the list on longevity. The highest is Japan.
Well, that's startling when you consider that America is often cited as being one of the wealthiest countries in the world. You'd think that we'd be able to take better care of ourselves than that. But I recently read something by the Center for Disease Control, the CDC. 6 in 10 Americans suffer from a chronic disease. They said 4 in 10 have 2 or more. And this was because of several lifestyle risks, 4 in particular. Tobacco use, poor nutrition, lack of physical exercise, and overconsumption of alcohol. Why do you think people aren't valuing their health as much as they should, Doc?
Well, I've known a lot of people that didn't value their health. Some of them really wanted to demonstrate to everybody how closely they could skate by. It's kind of like, the long tail feathers on a peacock, so how does a thing stay alive and drag all that stuff around? And so they'll maybe even take great pride in it. A great example from college is these dumb drinking contests. Who can chug a lug the most? Certainly at that point, nobody's thinking about their health. And so it's the psychology of it. And this affects the young. Something we ought to bring up is mental health. Something like 20% of all Americans are diagnosed with some mental health condition. And it's also been noted that of the people that have a problem with substance abuse of some kind, opioids, alcohol, whatever, about half of them also have some diagnosed mental condition.
So, what's good health, though? Preventative health is, well, we were just talking about how people don't value their health. Some of those lifestyle risks that the CDC mentioned were poor nutrition and lack of physical exercise. I remember a paper that you told me about the other day. It says that 71% of our youth today is ineligible for military service because of obesity, crime history, drug use, or they don't have a high school diploma. All of these things, are within the control of the individual. You can do things to prevent yourself from being sick, diet, exercise, healthy eating. But it seems like we've been in this mindset so long of curative health that we don't think like that. We kind of just hope for the best, and whenever we do get sick, we just go to the doctor, and it's their responsibility.
Oh, yeah, there's maybe over-reliance on the magic pill. I recall a couple of guys when I was young that smoked like chimneys, and they swore it wouldn't get them because if there was any danger in it, why, science would have invented a cure long before they got it. Didn't work. And so that's relying on the medical technology to let you get by with whatever you can. Mm-hmm. Whereas the really healthy people that I know don't necessarily obsess about their health every day, but they just live so that they are healthy. They get plenty of exercise. They don't have a bad diet. That gets you down to all the baloney that goes around diet today. It's been said that there's more BS in nutrition and diet than there is in politics. Well, I kind of doubt that, but there's a lot. Mm-hmm. And so you get all kinds of conflicting messages about what is good for you to eat.
Well, just in my mind, if that field of study is as muddy as you're saying, maybe the best thing to do is, focus on what not to eat, because that's a little bit more obvious, don't you think?
Well, it could be, except the people that say make junk food. There's a book called Sugar, Salt, Fat, and so they come up with, they call it a bliss point, especially for snack foods, but also some others, so that you want to keep on eating it. Mm-hmm. What they're doing is tricking your senses. And I think they know that, but they don't want to stop because this is competitive. They want you to eat their stuff and not that other company's stuff. And so from the view of competition, that may be pretty good. From the view of what they're collectively doing for us, not so good.
Yeah, and a lot of people, like I know people who are, living in poverty, and healthy food's not as accessible to them, so they often eat, a lot of fast food, things like this, and that kind of contributes to this poor health.
Oh, yeah. I got one friend, Ed Whitfield, in North Carolina, and he was so happy the last time I talked with him that after about 5 years, he finally had a food outlet that people could get to in his neighborhood, and they did not have to rely on the convenience store and really make a big effort to get to a place where there was good food. It's called a food desert. We have a good many of them.
Yeah, and when you're eating a diet consistently like that, whether it's good or bad for you, your gut microbiome, the organisms that live in your gut and help digest this food, they become, I've read reports, they become, maybe addicted is the word, and in turn, you become addicted to this food. You crave it more.
Oh, yes. A lot of research has been done, particularly the last 10 years, on microbiomes, particularly ones in the gut. And I think you've mentioned that there are more connections between the brain and the intestines than to any other organ. And so when you say pay attention to your gut, maybe there's something to that. And it is known that the diet modifies the organisms in that gut microbiome. It's also known that if you can regenerate the healthier microbes in the gut, you're probably going to feel better and actually be better. And so a little bit of medicine today is based on that. It's just barely starting, but that's kind of a preventive kind of thing, maybe somewhere in between, because if you're in bad shape, how do you get in better shape? That's remediation, curative of some kind. But once you're healthy, how do you kind of stay that way?
Yeah. Well, how do you?
Well, generally, if the diet consists of more whole foods, grains, fiber, make sure you got plenty of nutrients. Incidentally, if you go out to the ag area, it's known that the nutrient density of food's been dropping for 40 or 50 years because of the way the stuff is grown with commercial or industrial farming. And so making sure you're eating good quality food, that's quality over quantity, is a big part of the key. Can you afford to do that? There's kind of a stigma with it that that's only for rich people. And if you're poor, you can't afford it. Well, if you look at how much you're spending, maybe you can afford to spend a little bit more to eat a little bit less of the good stuff than in huge quantities of stuff that's tricking you with a bliss point.
How well is preventative medicine, that industry, how well is it taking off in America and other places?
Yeah, I noticed you call it an industry. That's how they think of it. It's why it frames the discussion so much. And so if you're really into healthcare, they'll think of the cost of the annual physicals or the rooms that people use for exercise, for wellness programs, and maybe a wellness nurse and a coach and, things that people pay for. Don't necessarily think, well, what do you just do differently without paying for much of anything?
Yeah, when you're thinking it from that framework, of cost, profit, it kind of almost takes the human element out of it.
Oh, yeah, and I've seen where physicians, your primary care physicians, do not like the programs that have rolled out on preventive health care because it had them doing all kinds of physicals, and then that took all their time away from treating people that really did have a serious illness.
Every time I go to the doctor, it's one of these situations where they order a bunch of tests that I most likely don't need. I'm 23. I'm in relatively good health, but they always want to do all these tests on me. And at one point, I went through with it. I was like, okay, I'll do it. Doctor doesn't mention it to me, but it's a separate billing. It was like $500 that I didn't have at the time. My health insurance didn't cover it.
Yes. Had the same experience, and I would guess if you've been in healthcare to speak of at all, you've had these little sneaky things that come up because the lab you used or some referent physician that you used was not in the insurance company's network, so they don't cover it. And that's all part of the hullabaloo over paying for health care. It's a mess. So how do you avoid that? Well, try to stay in a condition where you don't need much of it to begin with. Everybody's going to have some accidents, and you're going to have to go to the doctor once in a while. But way back when, the people that went all the time, we called them hypochondriacs. Toughen up and get with it, buddy.
We're living in an unprecedented period of rapid technological innovation. We've already seen the beginnings of people attempting to mix technology and medicine. For example, X-rays have been in use for a long time now. But given our understanding of the human brain and the central nervous system, the gut microbiome, like we were talking about earlier, we're starting to do things previously thought impossible, like restoring movement to paralyzed limbs, for example. What are some other innovations you see coming down the pipeline, and do they kind of shift? How do they shift this discussion that we're having?
Well, one big category of that has the heading called transhumanism, almost literally trying to make people superhuman or give us superhuman capabilities. And so some of those little experiments have not worked terribly well. 20, 25 years now, we've had mostly men experimenting with steroids, trying to get to be a real tough, macho person, and it wrecked their health. And so there's a long history to that kind of thing, doping, so there have been scandals in sports over this. But the other one is, can you hook people directly to a computer? And Elon Musk, of all people, is supposed to be having an announcement today on Neuralink. That's an attempt to really connect the brain directly to computers. And so instead of watching a screen, maybe you could watch it on your glasses, or maybe at some point the computer input-output would just go directly to the brain. And the artificial intelligence researchers been working on that for some time.
What are the health risks, though, of putting a piece of tech like that into your brain?
I don't know, and I don't know whether they know, and I don't know whether they're even asking the question very seriously. The Transhumanism organization has this code of ethics, but once you get rolling on it, how do you know? And until you have some idea what's going to be the effect, long-term as well as short-term, maybe you want to go slow on how much you're doing to modify Mother Nature just because you can.
Yeah, this is especially true for urban environments, where rates of mental illness are higher, when you're comparing it to rural areas. Stress levels in America right now are currently at an all-time high. You've mentioned to me in the past that, exposures to nature is a great strategy for reducing stress. Why do you think that's the case?
Well, I think we were maybe just made that way. We are part of nature, don't necessarily recognize it, but it's known that people under stress, if they just take a walk in the woods, it has a calming effect. You walk in the park, you see a little bit of green. I've known of 2 factories where they designed the factory with green trees growing all around and tried to organize work so that people could look out and see green any time of the day. And so without a whole lot of formal proof of it, this is kind of instinctive.
Well, how do you think that working with nature instead of working against it, how do you think that relationship would improve our health?
Well, if you're working with nature, you're not doing something terribly unnatural to yourself or to the rest of the environment. You work with it. You don't try to modify yourself to be something that maybe you were never genetically adapted to be. You're just trying to be Superman. And so you'd like to be something like that just for the prestige of it, perhaps, but long term, what's it going to cost you, and what would it cost society if a lot of people wanted to do that?
Mm-hmm. Well, what do you think success would mean in this area? Let me be more specific. What would be the ideal system for treating the sick and preventing disease?
Well, it's forming good life living habits that preserve health, including maybe more contact with nature on the part of more people. A lot of people don't know what they're seeing when they look right at nature, and so their eyes never see. And so understanding more about that is a part of going forward. Ideally, the physician, Zach Bush, who describes it, talking about compression, he wants to compress morbidity. And morbidity means the period of time you're sick. Compressing morbidity, and his ideal is that we could all live to be at least into our 80s, and then a period of chronic illness or the time we're really sick would be only a short time before we finally died and fell off the demographic table. And so a lot of people would live very full lives free of, having to run to the renal clinic about 3 times a week or whatever you have to do in a lot of cases today.
That kind of creates like this flat age demographic, and that seems like that has a lot of implications on society.
Oh, it does if we were really successful with it. Flat age means the population is no longer growing, and you would have about as many people, let's say, over the age of 65 as you have under the age of 20. And nearly all of our systems of retirement, insurance, legal codes, the whole bit assumes that you got a bunch of young people are going to take care of a few old people. If that's not really true, then you're really talking about a recognition and probably a different social contract to be worked out with a different kind of structure. Because our take on it is kind of the hangover from 9 to 5 or 7 to 3 commercial industrial thinking. You got work time, you got my time. There's a difference. You got work, and then you got retirement. Well, I haven't ever really retired, at least my own mind. And most people I know that are, quote, retired, just say, nope, I guess I'm retired, I quit the day job. But that kind of frames how we think. We need to think very differently about what life is, maybe what lifelong learning is. What does, quote, a career mean? That presumes you have an organization to have a career in. And so you start exploring this, and you're talking about a very different mode of thinking that if you have a business background, it's just tough to say, how do you transition from what we've got to something like that?
The people who own these hospitals aren't looking at sick people like a customer to sell services to. They're looking at them as they really are, a person that needs help.
Yeah, I've heard people, including my own son, who has there's no doctor in the town where he lives, not anymore. And when people go for health care, well, they zip in, they get 10 minutes max with a doctor, and he prescribes something, and here's your next test, or, so you're just kind of battered around the system. I think they're beginning to detect that this system's not serving them well. What do they want? Well, more like what's proposed by functional medicine, where you're not sick when you come in, at least you're not complaining of something, and your first interview with a doctor or a healthcare consultant might last 2 hours. Who are you? What do you like to do? What do you like not to do? What can we do to maybe adjust your habits of living a little bit so that you stay healthier? And so that's functional medicine. By the way, functional medicine is a coming branch of the mainline practice of medicine. Is not that they would not do something magical to try to cure you if you've got a real serious problem, but that the emphasis is not on curative. The emphasis is much more on how do you prevent people from needing curative care.
And that's a wrap, folks. If you enjoyed listening to this, please feel free to join us in our weekly teleconferences where we discuss the problems you and your community are facing while trying to think of possible solutions. The problems we're up against are way too large for any one person to tackle on their own. It takes all of us coming together. These dialogue sessions happen every Tuesday. You can participate by calling the number provided on our webpage. Times, topics, and the number to call are all found under the Compression Thinking Series tab on our website, www.compression.org. Also, please do not forget to like, share, comment, and subscribe. If we're going to make a dent in some of the issues we discussed today, it will take all of us coming together, and your support helps. I know it feels as if we've merely scratched the surface of this topic, so if you're interested in learning more, you can check out Doc's many papers, videos, and book reviews at the same website, www.compression.org. Thanks for listening, everyone.